Hello and welcome to Medical Dialogues. I am Dr. Bhumika Makhuri. Let's look at today's top medical news. Are you choosing the right workout for your personality type? A new study published in Frontiers in Psychology by researchers at University College London, UCL, suggests that matching exercise to personality traits could be the key to helping people stick with fitness routines and reduce stress. The study highlights how personality influences exercise enjoyment, offering a potential path to more effective, personalized fitness interventions. The new study aimed to explore how personality traits influence both enjoyment and adherence to exercise and the resulting impact on fitness and stress levels. Researchers recruited 132 volunteers with varying fitness backgrounds. Participants were assigned either to an 8-week cycling and strength training program or a resting control group. Baseline fitness was assessed using press-ups, planks, counter-movement jumps, and maximal oxygen consumption testing. Participants also completed the Big 5 personality assessment, which categorized individuals by dominant traits: extroversion, agreeableness, conscientiousness, neuroticism, and openness. Improved survival rates for people with dementia, global study finds. A new multinational study published in Communications Medicine has found that people diagnosed with dementia are living longer than in previous decades, signaling encouraging progress in dementia diagnosis, treatment, and care. The research, led by Dr. Hao Luo from the University of Waterloo, analyzed survival trends among more than 1.2 million people over the age of 60 across 8 regions from 2000 to 2018. Dementia remains a major public health concern worldwide. The research team assessed hospital data from Ontario, the United Kingdom, South Korea, Taiwan, Hong Kong, Finland, Germany, and New Zealand. The study found that in 5 of those regions, including Ontario, individuals diagnosed with dementia today have a lower risk of death compared to previous years. Can the Monday blues lead to chronic stress? Study says yes. A new study published in the Journal of Affective Disorders reveals that anxiety felt on Mondays can have long-lasting effects on the body's stress response system, potentially increasing the risk of cardiovascular disease. The research, led by Professor Tarni Chandola from the Department of Sociology at the University of Hong Kong, HKU, uncovers how Mondays uniquely drive long-term biological stress, regardless of whether a person is still working or retired. The study analyzed data from more than 3,500 older adults who participated in the English Longitudinal Study of Aging, ELSA. Researchers examined anxiety levels reported on different days of the week and measured cortisol levels using hair samples, which provide a cumulative record of the body's exposure to stress hormones over a 2-month period. They found that participants who reported feeling anxious on Mondays had 23% higher cortisol levels than those who felt anxious on other days. Mondays act as a cultural stress amplifier, said Professor Chandola. For some older adults, the week's transition triggers a biological cascade that lingers for months. This isn't about work, it's about how deeply ingrained Mondays are in our stress physiology, even after the year's end. Tummy tuck may help you keep losing weight, even years later. A new study published in the issue of Plastic and Reconstructive Surgery, the official medical journal of the American Society of Plastic Surgeons, suggests that many patients who undergo abdominoplasty, commonly known as a tummy tuck, continue to lose weight long after the procedure. Abdominoplasty is typically performed to remove excess skin and tissue after significant weight loss, particularly in patients who have undergone bariatric surgery or other major body transformations. While some plastic surgeons have observed ongoing weight loss in these patients, little research has previously confirmed this trend. To investigate further, researchers studied 188 patients, 97% of whom were women, who underwent abdominoplasty between 2018 and 2022. Most also received liposuction or lipectomy during the procedure. The average preoperative weight of participants was about 168 pounds with a body mass index of 27.7. That's all for today. Stay tuned to Medical Dialogues for latest update.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.